Thank you, Robert.
Let's start here and I'll paint with a broad brush, and you can narrow it down as you see fit in applying it to the Tommie McGlothen case. I would think the hardest part of being coroner would be that you start at the end of the story, and then you have to work backwards to construct the events. Do you see where I'm headed with this? Am I sort of pointing? Am I going in the right direction?
Yeah, Robert, you are. But sometimes it's not that difficult to do. Sometimes you get a lot of answers by the autopsy, and you can pretty much paint the picture pretty quickly. But that wasn't true in the McGlothen case. In the McGlothen case, I had scant details of what had happened, just a cursory idea of what had happened, and then the autopsy occurred, and there weren't a lot of issues on the autopsy that I could put my finger on, and then it became an investigation, and that's what we do. We investigate cause, manner, and time of death. So I had to work backwards, and with that, I had to get videos and offense reports and run sheets.
Excuse me just a second, Todd. Pardon me just a second, and you can sort of wrap up, but you're sort of answering my next question. When you start an autopsy of this type or any type where the police have been involved, do you have a report, the police report, then to look at that you are, bluntly speaking, comparing what the police say to what you see in front of you?
No, because the autopsy is done immediately. The offense reports have to be generated. So no, that's not the case. But either myself or my investigator are at the scene. So we do our own investigation. I mean, as soon as we get called, even if the patient dies at the hospital, we go to the hospital, we see the patient, then we go back to the scene, we do our own investigation. So we have an idea of the details, but we don't have the minute details. We've got a broad picture, and that autopsy could be done within an hour, and it's never done more than 24 hours after the person passes away. So, not everything's going to be ready by the time the autopsy is being completed.
Dr. Thoma, let me ask you this, because a lot of people are questioning it, that this has taken so long, excuse me, to come to light, that perhaps had the family had an opportunity, or did they have an opportunity to get an independent autopsy? Because it's been, that's back in April. They may say, coroner, you're good at what you do, whatever, but we want to get our own guy in. Was that opportunity afforded to this family?
I can't answer that question because I don't know. What happens when we do autopsies is that, the family was aware of what happened. They were aware that he died in police custody. There was family notification made, probably by the police department, because we know that family notification was made. I believe it was his father that was notified. Then the autopsy gets done, and as soon as the autopsy is done, we're finished. Okay, so my part of it, everything's been collected. We no longer need the decedent. So what we do is we release the body to the family, and the family at that point in time has complete control over that body. They can choose to bury. They can choose to get a second autopsy. They can choose to cremate.
Do they know your results at that point, though? Do they know what you have ruled?
I don't even know my results a lot of times at that point in time. We get what's called a PAD, which is a provisional anatomic diagnosis, which means that if we see something, if we see a heart attack, if we see a bleed in the brain, if we see something, we'll know that part of it. But it takes another 3 to 4 weeks, sometimes 5 weeks, to cut tissue, look under a microscope, get toxicology results, etc. So everything that we have initially is provisional, but we've collected all the evidence that we need to collect, and so we no longer need that decedent, and so the family assumes responsibility for that body.
Unrelated,
and they can choose to do with it whatever they want to.
Unrelated, is it harder to do a second autopsy after a first one's been done?
Yes, but they have the results from the first autopsy, and they have the second autopsy. So a lot of times it can be easier for them to see the major things, and maybe harder to do the smaller things. But no, it's a little bit more difficult, but it's not it's not that big a hill to climb.
What
They
is
can do that.
what is excited delirium, and how often do you see that? Explain to folks what it is.
Excited delirium is a neurologic state that's found sometimes in people with mental health issues, psychiatric disorders, people with drug abuse and stimulant abuse, methamphetamine, cocaine, mojo, some of the stimulants. And what happens in a situation like that is they have a sudden psychotic break that is characterized by confusion, disorientation, excitation, combative behavior, violent behavior, they're relatively impervious to pain. This is one of those things that we've seen for years and years and years, but the term excited delirium really got accepted by the medical community about 12, 13, 14 years ago. We were using it before that, but the AMA finally agreed that it's a true diagnosis and it's a neurochemical disorder. These people were the ones that we had always seen that died in police custody. So, and the reason that it was so frequent for them to have died in police custody is because they're causing a scene, they're acting out, they're violent, they're attacking people, they're running down the street naked, etc. And so the police have to go restrain them. And they are almost impossible to restrain because of the fact that nothing is logical. They don't respond to verbal stimuli. Nothing, you can't talk them down. So consequently, it's almost always, and I'm not defending anybody, don't get me wrong when I say this, but it's almost always a violent encounter to get those people restrained. We had the problem at the hospital.
Did your autopsy show what was the cause of Tommie McGlothen's excited delirium?
There's nothing on an autopsy that's going to show that. That's the reason that this was a difficult case. You know, I knew that he had been tased. I knew that a baton had been used on him. I knew that he had been maced. I knew there was a violent issue to it. So, of course, when we do the autopsy, the first thing that we're going to think about is, was there a problem? Was there a solid organ injury? Were there broken bones? Was there a head injury? Was there something that caused that problem? We did the autopsy on Mr. McGlothen, and all he had were soft tissue bruises and contusions. He had a black eye. He had a bunch of areas underneath his scalp where he had been hit, but there were no broken bones. There was no skull fracture.
No broken nose has been reported? No broken nose?
No, we had no broken nose. Nothing.
Okay.
I've started seeing that too. He had no broken bones. He had bruises under the skin in certain areas, but all of them were minor. And I don't mean it to be, when I say minor, I'm not implying that it was minor from what they did to him. That's not what I'm saying. I'm saying from a physical anatomic standpoint, they were what we consider in forensics to be minor injuries, non-life-threatening injuries. These are the ones that could be treated in an emergency department and looked at and sent home because there was nothing there that would require treatment.
So pardon my naivete and or ignorance, but wouldn't an autopsy, wouldn't you have done toxicology to see if he were, you had said, oftentimes excited delirium is drug-induced, methamphetamine specifically you mentioned. Wouldn't the autopsy show that?
We do toxicology on every autopsy. So yes, I mean, it was reported yesterday. His toxicology screen that we did was not helpful. It was not extended. It was a comprehensive but not extended toxicology screen, and he showed no evidence of drugs of abuse other than marijuana. So there's still a possibility it could have been synthetic marijuana, et cetera, but that wasn't the issue, and I'm not being insensitive when I say this. Mr. McGlothen had problems like this before. He had psychiatric issues, so he was at risk for this disorder.
Your report says he died of natural causes, but his death could possibly have been prevented. How?
Aaron, the reason I decided to do the press release yesterday, I had pretty much finished my investigation a couple of weeks ago. I didn't want the public to misunderstand. I ruled the death natural, but But a natural death in police custody kind of looks like, oh, just the coroner said it's a natural problem, and here we go again. This is a big cover-up, blah, blah, blah. The problem was that it was a natural death because he died of a natural problem. But the problem was it was a preventable death. There were still some issues. Because what happened was once they finally got him restrained, they put him in the back of a vehicle. Closed him in the back of the vehicle. And I can't tell you why. I don't know if it was COVID concerns or anything else. I mean, he had been spitting on people and et cetera. So there were some issues, but he was pretty much left unsupervised. And the dash cam video shows the next 48 minutes or the last 48 minutes of Mr. McGlothlen's life. He was checked on very, very, very infrequently, and you can watch him breathing very, very fast and struggling to breathe in the back of the vehicle. And this goes on for a very long period of time. And then towards the end of it, he slows his breathing, and becomes unconscious. So even though it's a natural death, it was a preventable death, in my opinion, because he needed medical care.
Didn't the fire department come out there twice? Is that accurate? And okay, why didn't they?
I have not, despite what they said in one of the other medias yesterday, I have not commented on the fire department. I was asked one specific question. Had they been out there earlier? And my response was yes. I gave no details other than that. I'll give you the same details. Yes, they had been there one time before and left and then returned when Mr. McGlothen had his cardiac arrest.
So it sounds like when you use the word preventable, that 48 minutes should not have passed. Am I reading what you're saying wrong?
No, you're not reading it wrong at all. What I'm saying is that it is my opinion that Mr. McGlothen, as I've already told you before, had an acute medical condition, a life-threatening medical condition, not just a routine psychiatric condition that I've got a psychiatric patient who needs medical care, etc. He had an emergency medical condition that needed to be taken care of. And had he been being watched, people would have known he needed medical care. And he was not given that medical care. And one of the things that I cannot understand is Mr. McGlothen was never going to go to jail. He was confused, disoriented, combative, not controllable. He would have been taken to the hospital. As soon as they finished up everything that they did, they would have taken him to the hospital. Nobody did that. And he sat in the car for 48 minutes while they filled out reports and did whatever else that they had to do at the scene, which I'm sure there was a lot that they had to do. So what I was saying was, even though he died of a natural cause, it was a potentially preventable death because if they make it to the hospital, chances are they're going to survive. So I was concerned that a decision was not made in Mr. McGlothen's best interest to take him to the hospital.
Witnesses have told reporters that the ambulance left the scene with not lights blaring, not in any kind of a rush, indicating he may have already been dead. Can you shed any light on that?
I can't. I don't know that. And I, to be very honest, I sincerely doubt that. And the reason I say that, and I'm not trying to call anybody saying people were being less than truthful, but no matter who they pick up, the fire department runs code 3 with lights and sirens. Even if it's a hangnail, they run code 3 with lights and sirens. And in this situation, they were doing CPR. So, I cannot in my mind imagine that they left. Now, they may have left the first time they came without lights and sirens because they didn't transport a patient. The second time they left, I can almost promise you they ran lights and sirens because they rushed him to the hospital to be resuscitated. So I have a hard time believing that, but I can't say that because I have no confirmation of that.